Welcome back to Core Anesthesia. Whether you are a student prepping for tests and boards or a CRNA here to earn CEUs, we are glad you've joined us. For more about us, make sure to check us out on Instagram at Core Anesthesia and online at coreanesthesia.com.
Welcome back to Core Anesthesia. I'm Cole here with Tanner, and today we want to do a discussion from our 2022 Student Anesthesia Conference in July. We're so excited to announce that several of the speakers gave us their permission to go ahead and post their recorded session so that those that were unable to attend would be able to benefit from the knowledge and wisdom that they had to pass on. We know it was beneficial to a lot of the people that were able to listen to it live, and we hope it'll be beneficial to you today.
Our next topic that we're going to cover is one that I'm really excited about. In fact, Cole and I took an entire podcast episode to devote to talking about our personal experiences with this, and we're going to be talking about mental stress and resources that are available for students during school. With every other session, we are going to talk about our sponsor here first. This session is made possible by Marshfield Clinic Health System. Marshfield Clinic Health System is seeking CRNAs in the Wisconsin area. In-house call, beeper call, no call, and casual opportunities are all available. $100,000 in student loan assistance during SRNA programs, excellent salaries of over $215,000 for new grads, and a new grad-friendly atmosphere. Post-call days are built into the work schedule, 9 weeks of vacation, W-2 employment with full benefits, and a family-friendly community. Additionally, Marshfield Clinic will pay for full relocation costs. Marshfield Clinic Health System gives exceptional professionals a place to call home. Please contact Jennifer, CRNA Recruiter, at 715-316-1448. Now it is my pleasure to introduce our next speaker, Cathy Horvath. Cathy Horvath DNP, CRNA, CHSE, is an assistant professor and program director of the DNP Nurse Anesthesia Track at Johns Hopkins University School of Nursing. Dr. Horvath has a passion for the well-being of anesthesia professionals. For the last 2 years, she has served as chair of the AANA Health and Wellness Committee, where she has increased resources, published, and spoken locally and nationally about health challenges and wellness strategies for anesthesia providers, faculty, and students. In addition, she served as a member of the AANA Curriculum Taskforce to create a framework of resources for educational programs to meet the COA standards of health and wellness content. Within nurse anesthesia programs where she has been associated, she has developed and implemented impactful health and wellness curriculum initiatives for students, as well as trying to role model healthy lifestyle choices. Dr. Horvath has been a CRNA for 30 years and continues to practice clinically. It is now our pleasure to welcome to the presentation stage, Dr. Horvath.
Hello, everyone. Again, my name is Cathy Horvath. I hope you're enjoying this great conference that Tanner and Cole have put together for you. And thank you for inviting me to speak today. As chair of the AANA Health and Wellness Committee and a nurse anesthesia program director myself, again, I was asked to talk to you guys today about how to maintain your health and wellness kind of as a student and as a future CRNA, because it's kind of a lifelong thing that we have to pay attention to. And I'm going to first acknowledge that it may not seem possible or easy to keep up with any kind of focus on your health and wellness during school. Nurse anesthesia programs are hard. Clinical rotations are hard. But maintaining even creating new ways to stay healthy and well are critical for you to survive and kind of thrive in the nurse anesthesia program. It's critical for maintaining your relationships with your family and your friends. And it's going to be critical for the patients that you care for. So again, I'm glad to be here today. So I always hate kind of starting with a negative, but we all need to understand that there's data out there for how you all are feeling right now as students of nurse anesthesia programs. Nurse anesthesia school is a huge transition. There are rigorous and never-ending academic demands that seem to kind of never ease up until you're done. There's loss of pretty good income from your nursing jobs you had before entering school. And for most of you, you're taking on a large amount of debt to finance your education. So that adds stress and financial strain. You're all transitioning into a new nursing role. You're going from being kind of this expert resource on your ICU units or your nursing units to now being the low man on the totem pole, and probably sometimes kind of wanting to be invisible so that people don't, criticize you or again, kind of some of those negative feelings. But then you're going to start transitioning into creating yourself into this kind of confident, autonomous, and independent professional. So there's a lot of adaptation that needs to occur there. Many times students, as you know, feel a loss of control over their life. They're spending most of their time doing things related to school. This leads to a lack of social time and loss of things that brought them joy prior to school. And then we kind of can't forget about COVID yet. COVID has added additional stressors to our lives, both for the patients that you've cared for and most of you, if not all of you, came from ICUs or in healthcare settings that had to deal with COVID. So that became very complex and was very sad at times. Programs were affected by COVID too. Some programs had to pull students from sites during COVID, missing clinical time, then forced these schools to restructure classes to ensure, students were going to be able to make up clinical hours. For some students, then there's an uncertainty that whether they're going to graduate on time. And then for all of you, probably more of your coursework became distance-based, right? So less face-to-face interaction. So this kind of social networking part of the program sometimes was lacking or missing. Students also, express a lot of self-doubt during this time. They're in, some people feel like they're in competition with their classmates and their academic achievements, or whether they have the abilities necessary to succeed. So there's a lot of self-doubt. And students can encounter incivility sometimes in programs or in the clinical setting. Students report, there have been studies that show that students report that supervisors and teachers are sometimes gossiping about students, eye rolling, whispering, even screaming at students. So I hope none of you on this call are experiencing that, but there has been data to show that that is occurring in places. So all of these factors have led to students that feel heightened anxiety, stress, and unfortunately, in some cases, leading to depression. And research is showing that this is kind of increasing in healthcare right now for everyone. And so, the data has shown that nurse anesthesia school is hard and has a lot of stress and anxiety. But then again, with the addition of COVID and some other complex things that are happening in our world, we're all feeling a little more stressed and anxious about things. There are also multiple challenges kind of to a student's mental and physical health, but I'm going to focus on some of the big things. And the first is sleep deprivation. You don't get enough sleep, and it's sporadic and it's unpredictable sleep. And it's kind of these ever-changing sleeping patterns. You may not be able to sleep well, you're waking up at odd times, or maybe just your clinical sites are requiring different off shifts. There's also lack of social time. All of your friends are still going out and having fun. They're going to the beach, they're meeting for dinner, they're getting together. Family and friends are, your family's getting together, but maybe you're not. Many of you are married and might have kids, and then there's the pressure to be home and spend time with them. you want to be home, but you have a lot of other demands of your time right now. And then in general, there's just, not enough time for things like physical fitness. And there may be choices of less commitment to having those healthy food choices. So all of these are challenges. And if that's not bad enough, some students to cope, and just many of us in general, turn to maladaptive behaviors to cope, right? We start turning in things late. Students will call out sick. They start not really caring about their academic performance. Again, kind of the poor eating choices. Don't feel like they have enough time for things like, even taking care of themselves. They may socially start to isolate, meaning they feel like they're pulling away from family and friends, and then kind of give up on trying to keep up. And then there's always the problem of excess of alcohol consumption, and then turning to illicit substance use, which is, again, in the literature showing to be an increasing problem. So I think some of you kind of are telling yourselves maybe, oh, when school is done, that's when I'll take care of myself, and I'll, maybe some of these things like I'm doing, like overeating or I'm not sleeping well, it'll all get better once I'm out of school, or maybe once I pass my boards, or maybe once I start my first job. I'll be able to correct some of these challenges or bad coping mechanisms. But for some of you, it just doesn't really work that way. We kind of have to work at our health and wellness all through our lives to keep ourselves healthy and thriving. And so, and some of these behaviors that we take on can have lasting consequences. So again, working on it all the time and trying to keep ourselves, our well-being positive and good. So I want to start by asking you to do a quick exercise with me. And you are obviously all remote. I can't see you, but I hope you'll indulge me for a minute. So when I say go, I want everyone to close your eyes, nothing more, just kind of close your eyes and be still and quiet and don't talk for about 30 seconds. And I'm going to time it, and there's just going to be silence. And so again, I'd just like you to close your eyes and be quiet for 30 seconds. All right, go. Okay, now you can open your eyes, and I'd like you to reflect a little bit on what you thought about for those 30 seconds. Was it happy? Was it optimistic? Was it grateful? Was it calm? Or was it stressed? Like, were you going through a list of things you needed to do once you were done? Or how long is this going to last? Or I really want to get up, or whatever. Or was it negative? And did you right away go to kind of going to those negative thoughts or kind of complaining in your head? And so the first thing I'm going to ask everyone to consider in maintaining or creating well-being during anesthesia school is to kind of pay attention to what you're saying to yourself. Pay attention to self-talk, what you're saying to yourself every day, and try to get rid of some of the negative talk and replace it with more an optimistic spirit that kind of started your journey. Try replacing some of the negative talk with positive talk. How we talk to ourselves directly affects how we are in our well-being. When we have negative self-talk, it affects our performance and how we perceive situations. So if you kind of listen to how you're talking to yourself a little bit more, you can catch some of that negative talk and you can kind of nip it in the bud and just kind of get rid of it and kind of let some of those negative feelings go. Very, again, something we could all do is just kind of pay attention to that self-talk. So now I want to transition kind of into the more positive part of my presentation and talk about how you can maintain or create that wellness in your life. And I'm going to offer some very simple strategies that you can all easily do now and really forever. And then later at the end of the presentation, I'll talk about some more complex strategies. And some of it surrounds just around work life or school life balance. And so others are just remembering the essentials of health and wellness. So what is school life balance? It involves finding the right balance of time and energy to dedicate to the demands of your career or your life or your personal life. And this equilibrium changes depending on what stage of life you are, what your personal needs, values, and circumstances. And why it's important is because a healthy balance between your personal life and your academic life will positively impact the performance you have in both. So now I'm just going to talk again about a few simple tips to help you get through the day, feel better, more energetic. And so we're going to talk about breathing, breath. And do you realize that you have the tool of breath that everyone has, and you can use it to juggle some of the negative talk, mounting stress, or feeling overwhelmed. And you bring it with you everywhere, right? It's free. It's with you all the time. And so in those moments when things are not going exactly right, just pausing, taking a big breath in, holding it for a second, and exhaling slowly is proven to physiologically decrease heart rate, blood pressure, catecholamine levels, and it makes you feel more calm. And so again, we can try another exercise here with breath. So I want everyone to sit up and kind of, if you're able to and you're comfortable to, and put your feet on the ground, on the floor if you're able to, and you can put your hands in your lap and relax your shoulders. And then just take a slow, deep breath through your nose, hold it for a second, and then breathe out through your mouth slowly. And then you can repeat it. And it's just a very quick technique that brings us a little bit of balance to our mind and body. It regulates our natural rhythm a little bit better, and it helps us deal with some anxiety we may be feeling. And so a great technique for the operating room where sometimes you need to pause, get your stress level down, maybe drop a medication. Our breath can really help us if we can slow it down and be very mindful of it. Drink water. Pretty simple, right? So just a reminder that water is essential, just like clean air and food and sleep and exercise. And so drinking water and staying hydrated helps us feel physically better throughout the day. And sleep. And again, I talked about what a challenge it can be in nurse anesthesia school. There just doesn't seem to be enough time to get good sleep. But sleep is really an important physiologic component. It's essential for life. We all have to sleep. Some of us need different amounts of sleep, but studies show that if we can consistently go to bed roughly at the same time, get between 6 and 8 hours of sleep, and wake up roughly about the same time every day, that we can get better, more restful sleep. And then again, that helps with our performance, our mood as we move forward. So we all struggle with eating well and exercise. And so I like to say we're all going to be, indulge at times. We're all going to have days where, our eating habits get a little bit off, but just eating nutritious foods in general, being very, being a little bit more mindful about what we're eating. And then exercise. Exercise can be a lot of different things. It can be walking around the block, and from that all the way to running a marathon, if you can find time in school to do something like that. But it can be stretching on a mat on the floor of your apartment. It can be doing push-ups, dedicating yourself. I'm going to do push-ups and sit-ups every day. So again, exercise doesn't have to be this hour-long or even 2 hours by the time you get on the right clothes and go to the gym to do something. But it really, you can be and be happy that you're able to do things every day to kind of move your body. So some other strategies are just kind of to let go of some of the that perfectionist mindset and just kind of let some of that go, and that will ease up some room for your mind to be open to more positive things. And so knowing that things aren't always going to be perfect will allow you actually to concentrate better and to be mindful of things that are going on. Identify for yourself what's most important in your life and prioritize things, and then make those things happen. Setting goals with a purpose for your life. Don't be afraid to unplug and take a break. I find sometimes that students, will say, "Oh, I spent 3 hours. I never left my apartment. I was studying. I didn't even eat." But sometimes we need those moments to unplug and take a break so that we can refresh our mind, refresh our bodies, and then it makes our concentration a little bit better as we move forward. And that goes along with setting boundaries. You have a lot of expectations of you during school, and so setting some boundaries, saying some no to some things, or limits on things will really help you. I'm sure you're learning a lot about yourself during the program, and your classmates, and what works and doesn't work. But kind of again being reflective of what works for you and what doesn't. And don't feel pressured by others to do things that work for them if they don't work for you. Just like preventing negative self-talk, I think just daily reminding yourself that you're surviving, you're thriving, you're doing what you want to be doing, which was nurse anesthesia school, and you really are moving towards your goal every day, and you can do it. And so I think reminding yourself every day that this is a goal that you wanted. You are moving towards it. Some days it doesn't feel that way, but you are, and you can do it. So this diagram really outlines kind of what self-care could look like for you. I've talked about some of these items. It's spending time with your family and friends, not even though they may be off doing things that you used to do but can't do now. It's really important to maintain that connection, even if it's just, I know your generation probably doesn't use the phone much, but, calling people, chatting with them, hearing their voices, maybe not spending a whole day going to the beach, but just spending an hour getting lunch or things like that. So again, family and friend time. Some people really enjoyed massage therapy or aromatherapy. It puts them into a calm state. Again, that exercise, getting outdoors, getting fresh air, seeing the sunlight, which can be a challenge, especially during the winter months, but that really does a lot for our mental health. Maintaining hobbies. Remember when you used to have hobbies before school? And so if you're able to maintain some of those, again, that's kind of getting to that lifelong protection of your health and wellness, is that you're maintaining these things through the hard times too. You might not be able to do them at the frequency you'd like, but you're maintaining those things that bring you joy and those things that you like. Again, just exploring. And the last thing is trying as best you can to control or minimize debt, because it does, it causes stress and strain. Here are some suggestions just on ways to help maintain that balance. Again, spending time with family and friends, time management, organization. Podcasts can help because you can be multitasking, like exercising and listening to podcasts around, which can be, and the podcasts themselves can be uplifting, be offering suggestions, meditation, things like that. Sometimes just talking to somebody who's been through it, whether it's an upperclassman in your school or actually an experienced CRNA that's in practice, to kind of get perspective of your life right now, and to know that you can move forward, you can get through it. These are some challenges. These are some things that maybe will make you see that you're doing it and you're getting through it. Maintaining a routine, especially around sleep, and then again, some quiet time always helps re-energize us. And then these next two slides are just a list of strategies that could be employed in your program to kind of help the whole program globally with your student body's mental and physical health and well-being. Sometimes just knowing where resources are important. So having a place where wellness resources are kept. Programs can offer classes. They can suggest walking areas around your campus or around the hospital facilities. They can provide exercise equipment in the school. That you can go on outings, which is always fun. Again, it gets to that social part. Schools can offer wellness days, a fitness center membership. So always ask at your university whether that is offered, because that's a great a resource for you. Even though you may not feel like you can get to it very often, usually those are close to campus or close to the hospitals, and possibly you might be able to get there, even if it's just for 15 or 20 minutes at different periods. Again, these are just a lot of different ways that programs can maybe help with student stress. I like to also just mention some of these. Again, I think hopefully your programs and faculty allow you to express how you're feeling, come to you and talk to you about certain stressful periods of your programs, and that they're receptive to finding strategies to help lessen those stressful periods, like around exam periods or assignment periods, or even just clinical things. And again, these are just more strategies around that programs can use. So the professional organization for nurse anesthesiology, you've probably heard this in other talks, as far as the AANA having resources around health and wellness. I think that the AANA has a plethora of resources that are available for students to support their well-being. There is as I mentioned, there is a health and wellness committee. There is always a student representative on that committee. And so they are always, suggesting and implementing things to help with student health and wellness, in addition to the whole committee as a whole. There are, for students of programs, peer-to-peer support sessions called the CRNA Shared Experience. They have been occurring, they started about 2 years ago, and they happen about every 2 to 3 months. And they're sessions you can come on. Sometimes they're moderated by a licensed counselor, and they're kind of facilitated, but they're really just a place for, students to come and support each other. So there's talk about, challenges that are happening in their program, or maybe even in their personal lives, and just asking for students to listen and to offer some support. There's also something in the CRNA wellbeing that's portal that's called Wellbeing Well Worth It, and it's basically you're able to go on and fill out a form posting suggestions to other students on how they have stayed healthy and well during school. And so these are written by other students, and they post them, and they're just giving suggestions of things that have worked well in their lives. And then the only other thing I want to point out on this slide is that there are free apps available on the AANA website that are available free for download. And they are apps around meditation. There's music apps, there's podcast apps. So again, if you would find these useful, I suggest that you look at these resources. Now, if you're in crisis and need help, you should be asking for help. You should be asking your friends, asking your program directors or faculty that you are needing help. And we all need help sometimes. If it gets in crisis, there is the American Foundation of Suicide Prevention that has a 24-hour hotline. You can see the number here. The hotline number is 1-800-273-TALK, the letters TALK. And so if you or a friend are in need and need to talk to somebody because you're feeling overwhelmed, then there is a resource there. And there's also a crisis text line where you don't actually have to talk to anybody, but you can text with a counselor. And again, that's a 24-hour, 7-day-a-week free support. And so you can text the number 741741, and that will connect you to a crisis counselor. And then again, the AANA has a helpline, a confidential support line, and that is 1-800-654-5167. And it's called this peer support line, and it mostly handles issues around drug and alcohol abuse, and kind of offers support around that. But really, anybody can call that line, and they would help direct you to a resource. And I have this slide here because if you're going through a nurse anesthesia program, it's hard, but unfortunately, some of you may experience an adverse or an unexpected traumatic event while you're in school. And this can be either a bad patient outcome, a mistake, or some other traumatic event that occurs during the program or during life while you're in school. And so for those of you, again, that are online today and you're looking for some additional support from, you can access this part of the website. And again, you can use some of those crisis resources that I had on the other slide to help you. But again, the AANA is very committed to providing you resources. And then for those of you in the conference today that are looking for some additional support from either a specific racial or ethnic group of CRNAs or SRNAs. There are a few diversity committees or groups that support students and welcome students into their groups, and they're listed here on this slide. So I encourage you, the AANA does have a diversity, equity, and inclusion committee. There are multiple DEI committees at the state level. So you could look at your state nurse anesthesiology group. There is a diversity in nurse anesthesia mentorship program founded by CRNA Lena Gould. And you can reach out to her for resources and to help support. There's the Bigger Dreams, Better Tomorrows Foundation. Again, that's a wellness support group, that is available. There's a Philippine CRNA Facebook, a Black CRNA Facebook, and then there's a Pride Foundation for CRNA. So again, if any of those speak to you, please feel free to write down that information and contact them. They would love for you to join their group. And then lastly, you can always reach out to me and I can try to find you the resources to help resolve any challenge you may be having. Again, nurse anesthesia school is definitely hard. I think when you talk to CRNAs, they'll say, I love being a CRNA. I never want to do anything else. But then pretty much they all say how hard school is. So we know this might be a challenging time. So please, find ways to keep yourself healthy, and please reach out for resources if you need them.
Thank you for listening to this pre-recorded session from our 2022 Student Conference. For more about our speakers, please read their bio in the show notes, and we'll see you on the next episode.